Your brain is your body's control center, shaping how you think, feel, and move. When something goes wrong, it can affect everything. Welcome to Your Brain, Your Health, a podcast from St. Luke's Neurosciences. We'll explore conditions that impact the brain, spine, and nervous system, and how they connect to your overall well-being so you can stay informed and take charge of your health. Thank you for joining us for today's episode, Neurological Disorders and Sleep, and when your brain won't rest. We're your hosts. I'm Dr. Eric Eustace, emergency medicine physician at St. Luke's University Health Network.
And I'm Dr. Dan Ackerman. I'm the section chief for neurology and the director of stroke and vascular neurology at St. Luke's. And today we are joined by the incomparable Dr. David Cohen, who is our section chief for the Division of Sleep Medicine. David, thank you so much for joining us today.
Oh, thank you, Eric. Thank you, Dan, for having me.
Welcome.
Absolutely. Now, sleep is something, this is a shared experience that we kind of all have. And before we get into some of these neurodegenerative disorders, just clear something up for me first. As we get older and as our risk for some different neurological challenges changes, does sleep change automatically just as part of our natural aging process, or is this something that is supposed to be the same throughout our lives?
Sleep does change as we get older. Best way to think of it, little children or toddlers have a ton of deep sleep. As we get older, deep sleep unfortunately becomes less and less, just something that is natural for adults to experience. The amount of sleep we get throughout our life as an adult doesn't really change too much. Maybe it goes down a little bit, but for the most part, even someone who's 80 or 90 shouldn't be falling asleep all the time. Like, they should still have normal alertness for the most part, relatively speaking.
With that, you mentioned deep sleep. Are you referencing some of the actual different stages of sleep?
Yeah, we should talk about that. There's different stages of sleep. So light sleep is called stage N1 sleep. We don't want light sleep. It doesn't help us feel rested. We all do get some. There is this intermediate stage of sleep called stage N2, which is kind of boring, but most of the night we're in that. Probably about half the night we're in this stage of sleep. Deep sleep is really good. Everyone wants deep sleep. It's restorative. That's something that we're in about 15% as an adult, again, lower as we get older. And then there's REM sleep, or rapid eye movement sleep. That's the dream state, and that's about 20% of the night. Our brain cycles through these sleep stages throughout the night in like a cyclical fashion.
And are there a lot of disorders that sort of interrupt that, or how do those stages of sleep kind of connect with this whole complex system we have going here?
Yeah, so the brain is obviously remarkably complex. There's a lot of different areas and centers of the brain. Each part does different things. A lot of the magic in sleep happens deep inside the brain. There's the brain stem, which is the part that connects the brain to the spinal cord. There's some centers there that are involved in sleep. There's an area called the hypothalamus as well, where there's a lot of these brain cells that affect sleep as well. And there's this interplay between these different areas.
Now, when we talk about neurodegenerative disorders, just to make sure that we're real clear on what we're really going through here, right? So we're usually talking about something that, and correct me if I'm wrong, is intrinsic to the brain, and something that over time, the natural history is that it will persist and potentially get worse over time. And there are certainly several different causes. There's several different types and subtypes of neurodegenerative disorders, but usually we're talking about something that is in the brain itself and not a symptom of stuff going on physiologically in the rest of the body, correct?
Yeah, I agree. That would be a good definition. So it's a problem within certain areas of the brain or certain types of brain cells, and the degeneration or injury to those areas then cause different symptoms over time depending on what the problem is.
And what would some of those diseases be called for our listeners?
So Alzheimer's disease, a very
Okay.
common one. That's the most common form of dementia that most people have heard of. Parkinson's disease, another neurodegenerative disorder that has a lot of interplay with sleep, which I think we might most likely talk about later.
Yeah, so talking a little bit about that. So how does Parkinson's disease affect sleep and vice versa?
So Parkinson's disease is a neurodegenerative process where people get different symptoms. Tremor at rest is a common one. People can have shuffling of their walking. It can affect memory over time. And sleep is very intimately involved in a few different ways. So people who have Parkinson's disease can have insomnia. That's pretty common in that condition. That may be in part due to stiffness. People are rigid. They can't move as well. That can lead to sleep disturbance. The brain itself leads to that as well. But beyond that, people with Parkinson's disease get a very unique condition, this thing called REM sleep behavior disorder. And that's an unusual condition where people are prone to acting out their dreams while they're sleeping. That's not supposed to happen. So, right, we dream, we have these really weird dreams. nothing happens. You wake up in the morning, like, was that real? Was it not? I don't know.
Did I actually fly?
Yeah, exactly. But you're still in bed, right? Like nothing happened. But REM sleep behavior disorder is where there's this disconnect that happens. And unfortunately, people then will actually physically act out their dreams because dreams seem so real that the brain then loses the ability to help people not move. So then people will have a dream that they're fighting, and then they'll wake up and they'll be punching their bed partner.
Wow.
Or they'll leap out of bed.
Is that pretty common amongst Parkinson's patients?
So it is. And actually, it's a weird condition because people can get REM sleep behavior disorder before they get Parkinson's. It's almost like a warning sign that if this happens, there's a risk Parkinson's can develop in the near future. So it's kind of a scary thing.
Are there other warning signs that affect the sleep that might put somebody at risk for either Parkinson's or dementia? Like if I'm worried about my sleep, if I'm like analyzing it,
right,
does that predispose me to certain neurological disorders?
Yeah, good question. Not really anything specific. And I tell everyone, I say, don't worry about your sleep with the risk of developing these conditions because we can't control that, right? If you see a problem that is concerning, get it checked out, but don't obsess about how much deep sleep you get that your watch tells you because we can only control what we can control.
Yeah, perfect.
Very true. And you mentioned REM sleep behavior disorder. How is that different, or how do we differentiate that from people who might just be more active sleepers?
Yeah, that's fair. Some people are really wild in bed, right? You wake up and the feet are next to the bed partner's head or the blankets are off the floor. Some people just move in their sleep and that's it. But REM behavior disorder is this distinct thing that people will have a dream. So if someone is woken up while it's happening, they could tell them what the dream was. Usually the dreams are that they're being attacked or threatened, and then they will actually do something physical that will match up to what the dream is. So the kind of thing we talk about is in REM sleep, our bodies are actually paralyzed. It's kind of a weird thing. So it's called rapid eye movement sleep because our eyes are bouncing back and forth, but our bodies are actually pretty much motionless or still. In REM behavior disorder, this disconnect happens where the bodies unfortunately are not paralyzed.
And so it's not just about movement or speaking or being active. It's really that, I don't want to say purposeful because you're asleep and in REM sleep, but it's that real connection between those movements and what's going on in your dream.
Yeah, that's a good way to put it. Yeah, so the dream, the content makes sense with the activity that's occurring. So there is a purposeful movement that would be with a dream. Like someone has a dream that a panda bear is attacking them, they're punching the panda bear, but then they're punching in real life.
Don't punch a panda bear.
Yeah, come on.
They're so fluffy.
Some people, though, I've talked to a lot of people that experience almost the opposite, where they instead, rather than the normal paralysis that happens during REM sleep not working. Instead, they wake up first thing in the morning and they remain paralyzed a little bit. They can't move when they first wake up. What's the deal with that?
Yeah, sleep paralysis. So that is another common thing. Now, sleep paralysis by itself is not with Parkinson's. It's kind of a pivot, but still, it's a very common thing and kind of weird and freaky. Have you guys ever had it?
Oh, yeah.
I don't think I have.
No?
Maybe.
Oh, it's all kinds of fun.
Yeah, I've had it once. So yeah, you wake up, your brain is wide awake. Hey, I'm awake, let's get out of bed. And then your body just doesn't move.
Won't move.
So it can last 30 seconds, arms don't move, legs don't. It's not just tired, like, oh, I can't get out of bed, I'm so tired. This is like, I literally cannot move. People who get it can be really freaked out because it's very weird. People who get it a lot kind of know, okay, this is happening again. You can kind of like wiggle yourself out of it, or if someone touches you, that can get you out of it. So that's a distinct thing. They're both related to REM sleep. So again, going back to the paralysis and REM sleep, sleep paralysis is brain awake, but the body just never got the signal to become unparalyzed.
So not necessarily dangerous in and of itself, but really scary.
Not at all dangerous, but scary potentially.
Just to pivot a little bit from Parkinson's, you mentioned Alzheimer's, and we've talked about the idea of adequate sleep and sleep quality being sort of one of the pillars of brain health that we use to try and help keep the brain strong, keep the brain working well. So what's the connection between sleep and Alzheimer's, and what happens to Alzheimer's patients with regard to their sleep?
So people with Alzheimer's disease can get various sleep disorders, insomnia can occur, and there's something called a circadian rhythm disorder. So circadian rhythm is something where there's an area in the brain that controls our body's natural sleep clock. We don't choose our sleep clock for us, the body chooses it for us. Now the thing with people with Alzheimer's is they can get a lot of dysregulation in their circadian rhythm, and then that can lead to tiredness during the daytime and problems sleeping at night.
Is that similar to sundowning? Or?
It could be. That's kind of could be
Okay.
part of it. So if someone has Alzheimer's disease, getting regular light therapy is super important. So especially people in care facilities, that's an important process, because even people who live at home with dementia may not get out of the house as much. Sunlight is the best thing you could do to help kind of regulate your circadian rhythm. Just getting early morning sunlight consistently, hard when it's rainy and cold.
Mm-hmm. Now, there are some other neurologic conditions that clearly have a big impact on sleep, but perhaps we wouldn't characterize as neurodegenerative disorders, because it may not be a sign of neurons being injured in the brain or something that's going to progressively worsen over time. A really common one that we've talked about on this program before is migraine.
Yeah.
And although migraine isn't something that inevitably leads to dementia or injury in the brain, but it is super, super, super common.
Yeah.
What's the connection with sleep and migraine?
Yeah, it's kind of two ways. So people who have a sleep disorder, and we can talk about some of those in a little bit, have a higher risk of getting headaches with that, and potentially worsen control of their migraine headaches. People with migraine headaches can get worsened sleep. They might wake up with a headache and then can't sleep. Or some of the migraine medications might contain caffeine, and then now their sleep is messed up. Or they're in bed because they have a headache and then their sleep worsens. So it's this vicious cycle sometimes.
So the migraines, although they can wipe people out, the migraine itself can lead to poor sleep. The migraine meds can lead to poor sleep. It'll really mess up your sleep hygiene because you're just stuck in bed. But then the poor sleep itself can bring migraine on.
Exactly, yeah. And we see people all the time who get referred to us in the sleep clinic because they have migraines and there's a concern they might have a sleep disorder. And let's say they have obstructive sleep apnea, for example, right, where they stop breathing in their sleep. We treat that. We see very commonly that migraine headaches get a lot better, or headaches in general can improve.
Well, you mentioned, so we've talked about a few neurodegenerative disorders and those impact sleep. Tell us about sleep disorders.
So there's some sleep disorders that are unique to the brain, some are not. So I mentioned obstructive sleep apnea. That's a mechanical thing where the throat just closes or collapses while someone's sleeping. It can lead to sleepiness during the daytime, poor sleep, has effects on blood pressure, the brain, other aspects of health. Insomnia, can't fall or stay asleep, very common. Depression, anxiety is a big cause. A lot of things cause insomnia. There's some that directly intersect with the brain. Since this is the neurology and sleep podcast, we'll talk about them. So narcolepsy is one that comes up a lot. So narcolepsy is a disorder where people are excessively sleepy. They fall asleep all the time. If I had narcolepsy, I might fall asleep talking to you guys, even though you're really interesting.
No, I have that effect
We are
sometimes.
very interesting.
No, I put
Wow.
plenty of people to sleep. You're interested.
So narcolepsy is, there's different types, but there's a type called narcolepsy type 1 or narcolepsy with cataplexy. There's an area in the brain called the lateral hypothalamus. And in that area, there's a type of cells called hypocretin or orexin. And people with narcolepsy can have a decrease in these cells. And then the brain cannot regulate sleep. And then people can get excessive sleepiness during the daytime. We talked about sleep paralysis before. People with narcolepsy very commonly get sleep paralysis because the brain kind of puts REM sleep where it's not supposed to happen at times.
And is narcolepsy something that is in young patients, older patients? What age do you normally see the onset of those?
So narcolepsy is actually one that starts in younger patients. So typically like teenage years is kind of when it commonly manifests. It's not uncommon for someone to suffer with symptoms of narcolepsy several years before they actually present to a sleep clinic because they may not realize that it is a problem. Like they might just say, oh, I'm just not sleeping enough, or it's high school and I have to wake up early.
Sure. So it sounds like there's a number of different neurological disorders and sleep disorders. So are there different treatments for each, I'm assuming? So for instance, like if you're having narcolepsy, you would want something that would help with your daytime sleepiness as opposed to maybe something else that might need some more assistance at night. So can you go over some of those treatments?
Yeah, so narcolepsy, you're right. The mainstay are medicines to help people stay more awake. For years, the first medicines that came out maybe 100 years ago were stimulants, right? Like amphetamines would be a common one, right? Or methylphenidate is like a newer version of one. Now there's some newer medications that came out in the last 30 years. Modafinil is one. Armodafinil is another one. So there's these daytime medicines that people take to help them stay awake and not fall asleep. Now, ironically, there's actually a nighttime medicine that's also taken in narcolepsy sometimes that is a sedative taken before bed and can help improve sleep quality in a sense, and that can actually lessen daytime sleepiness in narcolepsy. So that's sometimes in the medicine list for some people with narcolepsy.
Okay. And are there any advancing treatments otherwise like that that are out there or,
Right.
or things on the cutting edge that you might utilize?
So narcolepsy is actually a really cool one. So narcolepsy has medicines that are in clinical trials, and the medicines I mentioned before, that hypocretin and orexin, how they're deficient. The medicine is a orexin receptor agonist, so it's trying to increase the amount of hypocretin in the brains in narcoleptics. And the results in the clinical trials so far have been amazing, like so much more so than any medicine we have, to the point where if these medicines work as well as we think, people with narcolepsy may not struggle with sleepiness during the daytime.
That's great.
There's a feature or symptom called cataplexy we didn't talk about, which is, this is a weird one, I don't know if you heard of this. So people hear a joke and then they laugh and then they get weak in their body from laughter.
And they collapse down, yeah.
So they can collapse down. Sometimes it's more subtle, like my hand's weak or my speech is slurred, but it's this kind of constant thing people can get, and it could be sometimes very disabling or embarrassing.
Sure.
These medicines also seem really great for that.
Very cool.
Yeah.
Very cool.
Now, so we mentioned REM behavior disorder, and we've talked about sleep paralysis, a lot of these other movements. What about for people who have things like sleepwalking or other kinds of movements or feeling a need to move at night or during sleep? So
Right.
where does that fit into this spectrum, and how do we define those?
So sleepwalking, there's a lot of weird stuff people do in sleep. So, we see it all, right? So sleepwalking is what's called a parasomnia. So parasomnia means doing stuff in sleep that you normally do while you're waking, but you're doing it in sleep. So the classic one is sleepwalking, right? We're asleep, but then people will get up and walk around the house while they're still sleeping. Now, why does that happen? No one fully knows. It's basically thought that the brain just can't regulate these sleep stages well, so it starts to mix them together when it's not supposed to. Sleepwalking is one that's really common in kids, and usually people grow out of it. I'm using quotes that gets people, those listening at home. And over time, teenagers, people in their 20s just usually don't sleepwalk, but we do see some adults where it still persists or can reemerge.
And if someone is, I honestly don't know, if someone is sleepwalking, what do you do?
Yeah. So safety stuff, lock doors, lock windows, don't have a gun at home, just general stuff to make sure the home is safe. Now, if you see a sleepwalker, the general thing is gentle guidance to go back to bed. You don't want to physically touch them, because the best way I tell people is a sleepwalker is like a caveman. So you're operating on primitive reflexes. So if someone with sleepwalking is touched, they can actually punch or attack. Yeah, exactly. Yeah. So it's more like, hey, Dan, put down the cookies, let's go back to bed.
How did he know it was cookies? Have you been spying on me, David?
He knew exactly what you would eat in the middle of the night.
All right, so just sort of gently guide someone back to bed.
Yeah.
But don't touch them.
Yeah.
Use sort of voice commands, kind of talk them over.
Yeah.
Okay. So don't shake them awake.
Correct. And sleepwalking is generally often benign. Like people sleepwalk, but it's weird, but nothing bad happens. Now, there are times where people can get injured from sleepwalking. That's where we get more concerned. Or sometimes people can get socially embarrassed by it. And if that's the case, then we think more about, should we try to treat this?
Yeah. As we're talking about this, I'm thinking to myself, especially when we were talking about Parkinson's and Alzheimer's, do you find sometimes if you fix these sleep issues, do their overall symptoms in terms of their disease sometimes improve?
To an extent.
Yeah.
If someone has a neurodegenerative disease, there's this process going on in the brain that we just can't control from a sleep side. But I'm sure we all know that if we don't sleep well, our brain's not working at the best potential. So if you have Alzheimer's, Parkinson's, some other condition that's already affecting your brain function, and we don't sleep well, we're not at our best. If we treat the sleep disorder, there could be some improvement in that people notice.
Yeah. Since challenges with sleep are really common, and because someone listening to this, I could imagine them saying, "Gosh, do I act out my dreams? Do I have a little REM sleep behavior disorder? Am I going to get Parkinson's?"
Right.
So, I mean, what advice would you give to someone who's concerned about their sleep to help them know when to seek help, and what are some dangerous things as opposed to what are some of the challenges that we all have that are probably okay?
Acting out dreams would certainly be something that definitely merits seeing your doctor and getting that checked out, because that's not supposed to happen to adults and could be potentially dangerous. We didn't really talk about that too much, but people can leap out of bed and break an arm or other injuries. So that could be really serious and requires immediate help. But otherwise, we look at different symptoms, right? So if someone is very sleepy during the daytime, then that would be a red flag to get an assessment. If someone's describing they snore a lot or stop breathing or choke, that also would be a reason to get checked. And even now, that's not necessarily part of Parkinson's or Alzheimer's, but if someone has some other sleep disorder going on in addition to that, then that just kind of makes it even worse potentially.
David, for anybody listening, we talked a lot about a number of different topics, but is there one thing that you can recommend for those who want to sleep better tonight that they should take on and do?
That's a lot of pressure. So
you're our expert.
Yeah,
we don't pull punches, you know.
Yeah. That's fair. Well, my one thing will be several things, but it'll be all wrapped into one. Basically, get a consistent sleep schedule. So just try to understand, hey, when should I go to bed? When should I wake up? We talked about circadian rhythm. Everyone knows themselves the best, right? So if you have the option, try to sleep when your body wants you to. Now, unfortunately, we can't always choose that. Work can interfere with that, social obligations. And then just be mindful of different daily things, caffeine consumption, try to limit that late in the day. So just kind of lifestyle things.
Okay.
That wraps up today's episode of Your Brain, Your Health. Thank you for spending some time with us today. I hope that this episode helps you understand some of the really deep connection between our sleep behaviors, and some of the different neurologic disorders that can happen to people. And remember, paying attention to changes in your sleep and how you're feeling after those changes during the day can be very important to your health.
Your sleep is one of the most important investments for your health, and we hope that you found this episode today very beneficial, and hopefully you can share it with somebody you love. For more information, please visit St. Luke's Neurosciences at sluhn.org. As always, take care of your brain and your health.